5 of them. They all look the same. They sound the same. How to figure out these problems. This is not the same as this. It's not the same. They are different pathologies altogether. And don't confuse it's symptoms, not extrapyramidal symptoms with the syndrome. These are syndrome. That means they are bad problems, collection of bad problems compared to extrapyramidal symptoms, which is a manifestation of the part of that syndrome. So how do you master this portion? What is causing the problem? Okay, then the next one, think about NCLEX scenario, okay? How are they going to ask you that question? Then think about signs and symptoms. What are those? Signs and symptoms. Then finally, what is your treatment for this problem? If you do it like that, this will be, you will never forget how to treat this problem anymore. What do you think? What do you think is the problem leading to the causes of NMS? And the key thing is just an antipsychotic. The individual took an antipsychotic about NMS. It cannot be NMS if you're talking about something different. So that's the key aspect. So if you can figure out, think about what are we doing for this patient? What was he giving to the patient? Was the patient giving something else? If you're giving antipsychotic, then your answer choice, you should be thinking about that. And then what is EPS? EPS, the same thing, antipsychotic. I give you antipsychotic. I give you antipsychotic, and then you're doing the same thing. What is SSRI? Serotonin syndrome. It's related to that. Therefore, this patient may have received what? SSRI. That's the problem. That's all you care about. Now, what is malignant hyperthermia? The patient will have received inhaled anesthesia. So they are in surgery. They have to be in surgery. Okay, they've received that. So the causes is inhaled anesthesia and genetic problem. Then the thyroid storm. The thyroid storm is what it is, right? It's the thyroid storm is because they had surgery, right? Surgery. So surgery related to what? Thyroid. Yeah, he has surgery on the thyroid. So the first thing is that. Then the second thing, let's make it red so that you can understand this problem. The causes, now NCLEX scenario. What do you think the NCLEX is going to give it to you? What is the way NCLEX will present this problem to you? I give you antipsychotic. All of a sudden, your temperature is high. It's like the temperature has to go to like really high temperatures, not small temperature. High temperature, like 103 to like 105. You should have muscle problems, so muscle rigidity, right? You should have autonomic dysfunction. You see, I'm not giving you every symptoms. I give you key aspects. That's the way I try to teach. Those are something we call buzzwords. So this is what you will see. High temperatures, muscle rigidity, autonomic dysfunction. PS, the same thing. I give you antipsychotic, but not these kind of symptoms. It's a syndrome. This NMS is a syndrome. EPS is a symptoms. So you give somebody antipsychotic, and then they acting they're showing movement disorder. It's a movement disorder. That's why you have akathisia, acute dystonia. So the movement disorder is acute. So you have acute dystonia. That's muscle contraction problem. Acute dystonia. Then you have akathisia. You have tardive dyskinesia and Parkinsonism. These are the same things that you see with the individual patient. It's between them. And if I give you what is serotonin syndrome, all you have to care about is this. The individual, the scenario for NCLEX, you combine some medication, usually TCA, or I would say some medication, meds with SSRI. So meds that contain serotonin. Okay, meds contain serotonin. That you're not supposed to do that. That's all. You see, I'm giving you the fact. So pay attention. The fact will be patient is in surgery, or they are in the PACU after surgery, right? That's all. And they're getting sick. They're doing surgery on them right away, or they are in the PACU. They cannot make it to the floor. If they make it to the floor, they are not malignant hyperthermia. Thyroid storm, they've made it to the floor. So post, and they had thyroidectomy, post thyroidectomy, right? They already had the surgery. So they are on the floor. Then they have what? Signs and symptoms of hyperthyroidism. That's the NCLEX scenario. What is the symptoms? I already given to you. They're going to have what? Temperature, muscle rigidity, and that. So the above symptoms is what you're going to see. So see above. And the patient is getting sick. They're getting sick. That is NMS. The EPS, don't confuse that with what? NMS. There's no way you should confuse that with NMS. Why? Because there's four things I told you. If you don't remember EPS, remember this channel. You click on the channel. It's called Adapt NCLEX. Well, we are adapting to that. And that is adapt. Okay? And what is that? The A is the acute dystonia. This, all you care about is contraction of the muscle spasm. That's all. Severe. They will use the word severe spasm, but it doesn't matter. The second one is akathisia. What are they going to tell you? Patient cannot stop moving. There is no fever, but he cannot stop moving. He has like inner feeling of restlessness. Maybe I have to tell you what is Parkinsonism. It's going to look like a Parkinson patient. And you know what Parkinson patient look like. Marked face, right? Shuffling gait, drooling, right? Resting tremor. So look at them as like Parkinson. Okay. Then the other one is TD, tardive dyskinesia. It look like acute dystonia, but they have stereotypical, we call it stereotypical movement. They will be lip smacking, right? They will be blinking their eyes. They will be moving their head some way. Their head will be turned in one way. That was stereotypical movement. What happened? I give you antipsychotic. Did you see any fever there? Do you see any muscle rigidity? Do you see any autonomic dysfunction? Autonomic dysfunction is your heart rate and your blood pressure goes up. Right. And then my favorite, SSRI. What is the problem here? You're taking an SSRI. You have to know that, right? One of them is fluoxetine, right? And then you combine it with something that has what? Serotonin in it. And what are you going to see? All your symptoms are going to go up. Tachycardia, diaphoresis, everything. The key symptoms you're looking for in the case is clonus. Look for this, clonus and GI symptoms. That means diarrhea, right? Vomiting. Those are abdominal pain. Those are classic for serotonin syndrome. You see what I'm trying to do so that you don't confuse each other with this and that. Hyperthermia. You can figure out what the scenario will be, right? Patient just had surgery or is in the surgery, so in the PACU. So in the operating room or in the PACU, you see lock jaw. The jaw is fixed. You can't open the jaw. And then you check their CO2 when they are in surgery, anesthesia can see is going up and they have muscle rigidity. Those are the key, and they have to put that in the case if they want you to pick this answer. So I hope I'm getting through somebody. I know everybody. I know. But I really want to get into somebody, one person, at least one person. Because this is very important. You will never confuse them anymore. And then thyroid storm. You can make sense out of it. Signs and symptoms of hyperthyroidism. But where does that happen? On the floor. So they are on the floor means on the ward. The patient is on the ward and he has signs and symptoms of hyperthyroidism. What is hyperthyroidism? If you don't understand, it's the same as thyroid storm. Signs and symptoms of thyroid storm. Everything is up. Tachycardia, diaphoresis, diarrhea, hypertension, whatever you want to think of, that is up. Reflexes is up. Everything is like way, way, way up. Now you should be able to treat them because that's what the NCLEX will give you, right? How do you treat this problem? Look at the symptoms. The symptoms is a muscle problem. We have muscle rigidity. We got to stop excessive contraction of the muscle specifically. We got to stop that. But number one, this is an emergency. So it's ABC. Make sure the airway is intact, the breathing and everything. Then, whatever they're taking, stop the medication, right? Then stop the muscle contraction. One medication you should not forget is dantrolene. Okay, that's that medication. But before you give them the dantrolene, cool them down, calm them down as much as possible. So you have to calm them down. So you can cool them and give them diazepam. This is going to cool them down. The anxiety will bring them down. The priority medication is dantrolene to stop the contraction. Okay, it's going to stop the contraction of what is happening. Medication right there. This patient is supposed to be in the ICU. If they need to be intubated, intubated. They're going to get sick very fast. EPS. Don't pick dantrolene because they don't have that kind of muscle contraction. They have some contraction, but that's not it. If you don't know how to manage EPS, think about Parkinson patient. What do we give Parkinson patient? What is Parkinson problem? Too much acetylcholine, right? Acetylcholine is too high. and then dopamine is too low. And so we want to give them more dopamine, but decrease acetylcholine. What is going to decrease acetylcholine? What is going to decrease acetylcholine? In Parkinson patient, less dopamine, right? And more acetylcholine. And therefore, what you're going to do is increase the dopamine and then decrease the acetylcholine. So you have to block acetylcholine. Anticholinergic is going to block acetylcholine so that you can have more dopamine. Why do antipsychotic make patients look like that? It look like Parkinson patient because the first generation they block dopamine. So I need to give them anticholinergic. You can choose any anticholinergic you want. I mean, they will give you a bunch of them, but don't forget this one, benztropine. Okay, benztropine is an anticholinergic, and if you can recognize it, what that benztropine resemble? It resemble atropine. So it's an anticholinergic. So give them anticholinergic. Another one you can give them is diphenhydramine. Okay, it has anticholinergic effect. Okay, so these are the things you want to think about. So that's the treatment. For some of them like TD, you should just change the medication, change the medication, or all of them. So you can change the medication into something else. But this is the treatment of that. Serotonin syndrome. They look like NMS, right? We have to cool them down, right? Cool them down. And then what do? Block serotonin. Something has to block serotonin. But before you block serotonin, continue to cool them down. What is going to cool them down? Diazepam. Give them some diazepam and block serotonin by using cyproheptadine. This is what is going to block it. So this is your key aspect. It's all based on something you have to understand the concept, right? For malignant hyperthermia, what do? You do the same thing as what NMS. So all this, you just bring it here. It's the same treatment. So that's the treatment for that. The treatment for malignant hyperthermia, ABC, stop the medication, dantrolene. If they need to intubate them, intubate them. They have hyperthyroidism. It's the same problem. What do you do when you're treating hyperthyroidism? Think about it. It's pathophysiology. When you have thyroid storm, you have too much thyroid in place. What are the medications you use for hyperthyroidism? Tell me. What medication do you use? It's the same thing, right? Same thing. This patient may need to be in ICU. You need to cool them down, okay? And then you give them something that will block the thyroid hormone. What are medications that block thyroid hormone? PTU, okay? Metamizole, right? They may need to be intubated. You can intubate them, but control their symptoms as much as possible. But that's all you need to do. If you have any questions, just let me know. But this is something you should not let the board take that from you, right? So this is something you should not let the board take from you. And this is the website, adaptnclass.com. And we have the on-demand over like 112 lessons, over like 100 hours, close to 200 hours of content. And we have quizzes, a little bit of mini quiz bank. I mean, but if you want to enjoy, it's very cheap. It's like 75